Welcome to all of you. I'm Darling, the ATO Climate Educate Associate Director, and I'm very happy to welcome you all to the class learning series organized by ATO Climate Educate Project through the Committee for Education and Advocacy. So while we're waiting for more participants to join, may I kindly ask everyone to update your Zoom name for attendance purposes. You can change it to your full name and feel free to send a message in the chat with your country and or organization so we can get to know each other better. Here we have Leslie. Hello, Leslie. We have Carl, Raisa here, Ruby. Hello, everyone. Welcome on board. And before we officially begin, here are few house rules to guide us throughout the session. So Uh, for those who just joined, again, you can change your Zoom name to your full name for attendance check-in, and then feel free to use the webinar Zoom chat, but please be respectful to all participants and organizers. For participants, your camera option is disabled and is not required in this webinar. If you have issues with your connection, you may go to Climate Educate's YouTube page for live streaming. And please note that this webinar is a safe space for any opinions. Respectful expressions of views must be observed at all times. Okay, and thank you so much, everyone, for joining. And we're looking forward to a meaningful and engaging session with all of you today. And now, to officially begin our session, let me call our moderator for this event, Rashida.
Thank you so much, darling. Hello, everyone. Good morning, good afternoon, good evening from wherever you are tuning to. Thank you so much for coming for our Klima Learning Series, our class 4. And the topic of our learning series for today is climate change and inequalities of health impact. And today we're going to be having a very experienced facilitator in the person of Dr. Geminn Louis Apostol. Dr. J.Lo Apostol is a physician, educator, and researcher specializing in environmental public health, climate resilient health systems, and global health security. He currently leads the Environmental Health and Global Health Security Program at the Ateneo School of Medicine and Public Health, and currently serves as a technical advisor to the Philippine Interagency Committee on Environmental Health, where he helps convene government, academia, civil society, and the private sector towards generating evidence, developing policies, and operationalizing programs for the protection of public and planetary health. Over the past decade, Dr. Apostol has led and served as a consultant to various national, regional, and international environmental health initiatives, from developing the Philippines National Environmental Health Action Plan and National Action Plan to combat antimicrobial resistance, establishing the Philippine One Health Action Plan, building evidence on the impact of climate change on the infectious diseases, mainstreaming air pollution control strategies, and raising public awareness on the health impact of environmental toxicants. Dr. Apostol received his double degree in Doctor of Medicine and Master of Business Administration from the Ateneo School of Medicine and Public Health and the Ateneo Graduate School of Business. He's a Senior Atlantic Fellow for Health Equity at George Washington University, an Environment and Sustainable Development Fellow of the U.S. Department of State, and a Scholar and Postgraduate Fellow at Murdoch University, Australia, specializing in One Health. He completed his MSc in Global Public Health from Queen Mary University of London and completed his PhD at James Cook, Australia. Wow, um, I'm personally impressed, and I can assure you I brought you the best of the best to facilitate this session. So join me in welcoming Dr. Jello Apostol to facilitate this session. Thank you so much. You're welcome, Dr. Apostol.
Thank you very much, Rashida, for that very kind introduction. I hope you all can clear me. I hope you can all clearly hear me. It's quite rainy here in the
Yes.
Philippines. And also allow me to share my screen. Okay. I hope you can all clearly see my screen. Before I continue, allow me to briefly introduce our institution.
Yes, I
Once
can.
again, can you see my screen now? Can I please confirm? Yeah, so as I was saying, allow me to also first briefly introduce our institution. I come from the Ateneo Center for Research and Innovation, or ACRI. ACRI is the research arm of the Ateneo School of Medicine and Public Health. And ASMPH is the first medical school in the Philippines that offers a dual Doctor of Medicine and Master's in Business Administration degree. And we believe that by combining the tools of leadership and management with clinical and public health excellence, we hope that our school will produce the kind of health leaders that our country desperately needs. And at ACRI, we don't just produce research, we produce research for impact, working across our four flagship programs: mental health science, health governance, biotechnology, and the program I lead, environmental health and global health security. So our research portfolio spans environmental health, One Health, climate and health policy and systems research. And more than just producing this research, what gives us the most joy is our work on the ground. We work with communities through citizen science initiatives. We conduct health, risk, and impact assessments. And most importantly, we try as best as we can to translate and broker the evidence that we produce to influence national policies and action plans, which includes, among others, our most recent and the first in Asia, our strategic roadmap on health and climate change. And that really brings us to our session today on climate change and health. And over the next 30 minutes, I want to first to be able to updates on the latest climate science, where we actually are. Is I was hoping to also spend a bit of time to discuss some inconvenient truths, particularly the politics and the power dynamics and structures that shape our current climate reality. And then, since this focus is not just on climate change but also on health, we shall then explore more deeply the nexus or the interconnections between climate change and health impacts. And lastly, I'd like to end with a call to courage. What does it mean for academic institutions, for advocates like you, to be able to lead in this warming world? I guess really the thinking here is that climate change is not only a scientific crisis. I'd like to establish as early as now that it is also a crisis of imagination, governance, and moral courage, where we as academics, as universities, as advocates, can have a very critical role to play. So first, let's start with the climate science. And I'm really hoping, I've given this lecture before, and I hope as much as I can to not overwhelm you too much. But this is really to orient you, to orient ourselves with clarity about our current climate reality. So when we look at our global temperatures and compare it to pre-industrial revolution levels, we now have the science to establish that we are at least 1.55 degrees Celsius warmer compared to pre-industrial levels. And according to a research led by the University of Leeds, particularly Professor Foster, at least 1.36 degrees Celsius of these 1.55 degrees is directly caused by human activities and is primarily a result of global greenhouse gas emissions remaining at an all-time high. And the main human activities responsible for this warming include, of course, the burning of fossil fuels, but also, and a lot of people forget this, deforestation, and quite significantly, our agricultural processes and industries, particularly intensive farming or intensive livestock. Another way to also look at our current climate reality is to understand our carbon budget. The Paris Agreement establishes that we are establishing a threshold of warming to up to 1.5 degrees Celsius. And in order for us to maintain or reach that threshold, we need to economize the amount of. Hello? Can you still hear me?
Yes, we can hear
Yes,
you.
we can hear you.
Okay, I think there was just a bit of a problem with the. Let me just try to share my screen. Can you see my screen again?
Not yet.
Okay.
Yes, we
Yes.
can see it.
Okay. So, as I was saying, the Paris Agreement establishes a threshold of 1.5 degrees Celsius, beyond which a global warming of 1.5 degrees Celsius compared to current levels. Beyond that, we do anticipate significant impacts to not only health, but to human life and to all life forms, significant economic and social impacts as well. So we have a 1.5 degrees Celsius target or lower. And in order for us to meet that threshold established by the Paris Agreement, we have to economize our carbon budgets. We have to minimize as much as possible the amount of carbon emissions that we are producing for our various different activities and industries. So, when we look at our current rates in 2024, the remaining carbon budget that we have to meet that 1.5 degrees Celsius threshold of the Paris Agreement is now just around 130 billion tons or 130 gigatons. And that is down from 500 billion in 2020. The carbon budget, as mentioned before, is the amount of carbon dioxide that the world can afford to emit to have a 50% chance of limiting global warming to the Paris Agreement threshold of 1.5 degrees Celsius. And when we look at, again, we only have 130 gigatons. And when we look at our current emission rates of around 40 gigatons per year, that carbon budget could easily be exhausted over the next 3 years, meaning that 1.5 degrees Celsius goal may be surpassed in a couple of years' time. And because of that, and according to the United Nations Environmental Programme's Emissions Gap Report of 2025, the world is on track. We are anticipating an increase of 2.3 to 2.5 degrees Celsius of global warming this century, way beyond the 1.5 degrees Celsius target. And that is even if we fully implement all our current nationally determined contributions. And if only current policies are implemented, the projection for warming is even higher, up to 2.8 degrees Celsius. And to align with this 1.5 degrees Celsius target, global emissions would really need to be significantly lower. So, in order for us to meet that 1.5 degrees Celsius, we need to make steep cuts, okay? Not just go business as usual. But right now, no, even if we implement our nationally determined contributions and current policies on climate change and carbon emissions reduction, we are still anticipating a little above 2 degrees Celsius increase in temperature over the next century. And if we do not change our ways, we are even anticipating an increase of as much as 3.2 degrees Celsius. Now, you may say, oh, these are very marginal increases in temperature. But just to demonstrate the difference between 1.5 degrees Celsius and 2 degrees Celsius, you can see here on the diagram on the right that the consequence of that 0.5 degrees Celsius can be very consequential, significant, and even catastrophic. As you can see here, unless there are immediate, rapid, and large-scale reductions in GHG emissions, limiting warming to 1.5 degrees Celsius will be beyond reach. So the difference, no, between 1.5 degrees Celsius and 2 degrees Celsius leads to Number one, significantly warmer, as much as 2.6 times worse, than the current number of extreme temperature days that we are experiencing on an annual basis. But more than that, the additional zero point 0.5 degrees Celsius will expose people not only to more hot days, but severe heat waves as much as 1.5 to 2 times every 5 years. In terms of water stress and droughts, an additional 62 million people would be exposed to drought yearly between 1.5 degrees Celsius and 2 degrees Celsius. In terms of sea level rise, we are anticipating more than 10.4 million people, in addition, will be exposed to the effects of rising sea levels, as well as, when sea level rises, the salt water also intrudes, what we call saltwater intrusion, and that can affect food security as we experience saltwater intrusion on our agricultural and food systems. But the greatest impacts would be on our ecosystem and biodiversity. The impact of that zero point 0.5 degrees Celsius can be catastrophic for our coral reefs. Okay? At 2 degrees Celsius, virtually 99% of our coral reefs would be destroyed. When we talk about our flora and fauna, around 2 to 3 times worse loss in biodiversity of insects, of vertebrates, many of which are very important when it comes to maintaining balance of our ecosystems and also ensuring food security. So in short, 1.5 degrees Celsius represents a relatively but significantly safer world that avoids many of the most catastrophic and irreversible impacts of climate change that would occur at 2 degrees Celsius. Imagine if it even gets worse if we increase warming to beyond 2 degrees Celsius. But it's also not just climate change that we are facing as an environmental crisis. Our planet's vital signs, as demonstrated here by our planetary boundaries developed by Johann Rockström, are, as you can see here, they're flashing red. What that means is that we have gone over the threshold, the safe threshold of our planetary boundaries. So just to familiarize you with the concept of planetary boundaries are, these are scientifically defined guardrails that keep the Earth's system stable and habitable enough to support not just human life, but all life in this planet. So we're talking about 9 boundaries or 9 systems. We have climate change, we have biodiversity, we had our land systems, we have fresh water use, we have nutrient cycles, we have the entrance or maintenance of novel chemical entities, and ocean acidification. But as you can see here, and based on the Planet 2025 Planetary Health Check, we have already breached 7 of our 9 planetary boundaries. And we are clearly living in an era where, there has been a massive acceleration in not only population growth, but consumption, fossil fuel use, industrial expansion, and these factors that have driven us to cross these planetary boundaries. Carbon dioxide, methane, nitrous oxide concentrations are at all-time high. Our forests are shrinking. Our biodiversity continues to collapse, and we have lost as much as, like 60-70% of every life form that has ever existed on the Earth. And, the message here is clear that the Earth is leaving its safe operating space. And again, the planetary boundaries, the planetary health check, are a reminder for us that, if we breach these boundaries, we risk destabilizing the very systems that sustain us and all life forms in this planet. The region that we are in, the Philippines, is in Southeast Asia. And for us, while this is a global problem, it's also something that's very close to home. The Philippines, along with other Southeast Asian countries, is actually ground zero for climate impacts. We've recorded heat waves, increasing number and intensity of heat waves just over the past 3 years in Thailand, in the Philippines, in Myanmar. 19 out of the 25 Southeast Asian cities are highly exposed to sea level rise. And in fact, over 225 million people in Asia Pacific are expected to be displaced by sea level rise. And that 225 million represents 75% of the global population that is expected to be displaced because of sea level rise. And of course, we talk about disaster burden. We talk about increasing intensity and frequency of typhoons, which I'm sure you may have heard of or seen in the news. What happened in the Philippines, in Thailand, in Indonesia, especially just this year. But there's also a very important paradox here. Asia produces approximately 50% or more of the world's carbon dioxide emissions today, with roughly, more exactly, 52.2% in 2023. However, most of this energy consumption driven by fossil fuel use is for export manufacturing produced in Asia for richer nations. So while the production is here, we'd like to assert that historical responsibility may lie elsewhere. And you can see here the dynamics really between the global north and the global south, which we hope to also talk about in a bit. And with that, no, allow me to seg into some of the uncomfortable truths that rarely make it into climate change and climate and health presentations. We talk about the politics, the power structures, and false solutions that obstruct meaningful climate action. So we do understand that no country is immune from climate change impact. But researchers have concluded that in almost all cases, and we've known this for decades now, that the countries contributing the least to climate change will be the ones who will be significantly, immediately, and urgently affected. That makes climate change an equity issue because there's a fundamental injustice when you come to think of the fact that the global north is responsible for approximately 70% of historical cumulative emissions, and yet the global south, countries like Africa, the Philippines, and the rest of Southeast Asia, we bear about 80% of climate-related deaths and losses. We talk about poor, undeveloped, or underdeveloped nations with limited resources to respond to the critical challenges of climate change. But of course, there's a very important exception here. The only country where we see a direct or parallel relationship between climate emissions and climate impacts is the one here encircled in black. Anyone would like to venture a guess? So what I was saying is that there is a inverse relationship between greenhouse gas emissions and impacts. Those who produce less experience the impacts more, except for one country. Can anyone venture a guess which country emits as much as they experience climate impacts? Anyone would like to venture a guess? It's Saudi Arabia. That's correct, Carl. So with the exception of Saudi Arabia. But for the rest of the world, the mismatch is extreme and fundamentally unfair. And this inequity in emissions versus climate impacts, this is not a natural inequality. It is manufactured by lines of politics and power that influence the decisions shaping our common future. Allow me to talk very briefly, as you can see here, about what's happening in COP, no, a conference of parties, which is the largest global platform on climate change, and where most of the decisions and negotiations on climate change, on transitioning to renewable energy, on phasing out fossil fuels, where all negotiations and decisions on our climate reality are being determined. Specifically, I'd like to draw your attention to the number to an issue that we have seen, but has now been made more stark with the last two COPs in Baku and now recently in Brazil, wherein we saw a record high number of fossil fuel lobbyists at COP. In COP 30 in Brazil, I think it was KBPO the Kick Big Polluters Out a coalition that revealed that over 1,600 fossil fuel lobbyists were present. And that's, I think, even so much more than the number of fossil fuel lobbyists that attended in COP29 in Baku, Azerbaijan. And when you look at uh, that number relative to other sectors, that's roughly one fossil fuel lobbyist in every 25 people at COP. And for us in the Philippines, it's even much worse. They outnumbered the number of delegations from the Philippines and from other countries who are very much at risk from climate change. In fact, when you compare fossil fuel lobbies to the Philippine delegation, they outnumber us by 50 to 1. Why is this an issue? Think of it this way. It's like you're asking the arsonist, the one who causes the fire, to help design the fire safety policy of your building or your organization. Fossil fuel companies, they're the largest source of climate pollution in the world. And in fact, we can narrow down most of greenhouse gas emissions over the past century to roughly 100 fossil fuel companies, and 25 of those contribute as much as more than half of the greenhouse gases that has been released over the past century. This is problematic because these lobbyists, they protect the fossil fuel industry's revenue streams, and they influence the negotiations to either dilute or delay climate policies, particularly those related to phasing out fossil fuels. And what's even more hurtful is that while these lobbyists could freely waltz in, other, critical voices, we talk about, affected nations, we talk about indigenous people, they even had to protest just to gain entry to these decision-making spaces, further highlighting, the inequity in terms of the voices that we give when we talk about shaping our current and future climate reality. Another inconvenient truth or conversation that I like to raise is, this preponderance and prevalence of false solutions to the climate crisis. We must be able to distinguish between false solutions and genuine and transformative climate action. False solutions, these are often corporate or market-based approaches that tend to pose themselves as climate action, but really fail to address the root causes of climate change and often perpetrate social and environmental injustices. True solutions, on the other hand, these are your rights-based, community-driven initiatives that tackle emissions at the source and operate within what we'd call a just transition framework that aims to shift power and economies towards sustainable and equitable systems. Now, let's all bring what we have discussed so far to health. And I'd always say that health is the human face of the climate crisis. And in fact, health might be our most compelling argument for transformative and urgent climate action. This diagram from the US CDC and adapted from JPATS shows the far and wide-ranging health impacts of climate change. You've probably seen versions of this before, but what we would always say in the Philippines, especially when we were doing our own climate and health or climate-related burden of disease assessments, almost what we have discovered is that almost every disease can be linked directly but also indirectly to climate hazards and disasters. Let that sink in. Of course, we have our typical climate-sensitive diseases like heat stroke, heat exhaustion, vector-borne diseases. But climate change, as you will see later, can also impact access to health systems. And that way, climate change can indirectly impact almost every disease. So let that sink in. Almost every disease. We talk about rising temperatures driving vector-borne diseases, extreme weather events causing injuries and mental health crisis, drought affecting or leading to malnutrition and water-related diseases, floods contaminating water supplies and spreading disease, environmental degradation, forcing migration and conflict, and climate change interacting with air pollution to worsen respiratory and cardiovascular diseases. So the point here is that climate change isn't just one more health issue to add to the list. Climate change is a threat multiplier. It amplifies every health challenge that we are all already facing. So think of climate change as the background operating system that runs underneath all of the health problems that we are experiencing today: heat, air pollution, food security, water security, infectious diseases, even cancer. They are now all climate sensitive. So again, climate change is not just one more health problem, it is the context in which all health problems now exist. Let's look at where the evidence is strongest. The Lancet countdown of 2024 found that 10 of 15 of our health indicators reached record levels as a result of temperature increasing way beyond 1.5 degrees Celsius. Temperature increasing as brought about by human caused climate change. Notably, the evidence is highest in the areas of heat mortality, food insecurity, disease transmission, and air pollution exposure. And according to the report, without human caused climate change, we would have expected people to have experienced close to 60 days of life-threatening temperatures each year. But because of climate change, we are now expecting global populations, but most especially vulnerable populations like the elderly, both the very young and the very old, to be exposed to as much as 86 life-threatening temperature days every year. And it's not just heat stroke or heat exhaustion that we are worried about. Extreme heat physiologically also affects many of our systems. It affects mental health. It leads to cognitive dysfunction. Extreme heat also triggers a lot of systematic inflammatory reactions, which is why it has been linked to stroke, hypertension, diabetes, but also it affects respiratory function and even the optimal function of your kidney, especially when you are severely dehydrated. Sociologically, or more than its impacts on individuals or biological impacts, extreme heat also affects our food systems. It affects food security. We are anticipating more than 127 million more people experiencing moderate or severe food insecurity as a result of temperatures increasing way beyond our 1.5 degrees Celsius threshold. And in the Philippines, we have data to prove that. Based on our climate attribution studies, as much as 60 to 70% of our malnutrition prevalence over the past 5 to 10 years have been, in fact, or can be attributed to warming temperatures brought about by human-induced climate change. And what's even more ironic about it is that the first ones to go hungry, the ones who will be most affected because of malnutrition brought about by climate change, would be our farmers, our fisher folk. So it's quite ironic that the ones who produced our food are the first ones who will go hungry because of climate change. And also, when we talk about extreme weather events, it's not just extreme heat. We are also talking about the increasing intensity and frequency of extreme weather events like this. In 2024, for example, we experienced 6 super typhoons in a span of 1 month in November 2024. Just a couple of weeks ago, you may have seen this on the news. Various provinces from the northernmost part of the Philippines down to the very south have been affected by a series of super typhoons, causing massive loss of life, livelihood. And this is the current reality of the Filipino people right now. Yeah. These are not movies. This is our current reality. And I hope you allow this to disturb you in some way, to shake us. Because if we become numb to this, if this becomes just another climate disaster, just another news cycle, then I think we've lost something essential to our humanity because this cannot be normal. We cannot accept this as inevitable. We tend to think about climate impacts on health in simple terms, like injuries, deaths, maybe disease outbreaks. But the reality is far more complex and far reaching. So when you look at this framework, climate disasters impact health through four interconnected pathways. First, there's a direct impact on population health. So we talk about physical injuries and deaths, but also trauma and mental health effects, many of which will last for years. Um, we also talk about communicable diseases that spread in evacuation centers and the exacerbation of chronic illnesses when people can't access their medications. Second, we have your direct impacts on the health system. So the health system, not just health outcomes, is also a victim of climate change. We talk about damaged hospitals and clinics, health workers, supply chains being disrupted, so that medicines not arriving on time or being destroyed because of because of exposures to flooding or to meteorological elements. We have health programs like immunization, prenatal care being completely interrupted. But then, those are the direct impacts. And then you also have the indirect health effects and indirect impacts on health systems. So on the population side, you have people losing access to primary health care. They lose their income, they can't afford medical expenses. And climate change also impacts, the social determinants of health, which are very important when it comes to accessing healthcare, housing, nutrition, sanitation, because all of these collapse every time we have climate disasters. And on the health system side, you have roads being destroyed. So ambulances, for example, can't reach communities. You have health budgets being reallocated to emergency response. And you have health resource being redirected away from routine services. So this is critical to understand. When a climate disaster damages the health system, that damage then amplifies the health impacts on the population. It's a vicious cycle. People get sicker, and the health system that's supposed to care for them, is simultaneously being destroyed. And when we try to understand climate disaster impacts on public health, this isn't, again, just about immediate emergency or direct physical or psychosocial trauma. It's also about impacting health systems that will take years to rebuild. Okay? Chronic diseases that go untreated for months. Children who miss their vaccines and will be exposed to diseases their entire life. Pregnant women who will not be able to access prenatal care. Impacts that will ripple forward in time, creating health burdens that will outlast the disaster itself. Which is why it's very important to talk about the public health sequelae of climate disasters, because clearly it doesn't stop after the rains. This is what happens when the rains have stopped, and yet, many of the houses are still flooded. So many people in the Philippines have to resort to stay in what we call evacuation centers. This is a picture of what an evacuation center looks like in the Philippines. And I'd say this is also the perfect setting for the perfect storm for the public health sequelae that happens every time we have a climate disaster. Beyond, the immediate injuries and deaths, we have to manage death at a massive scale. After our, most significant super typhoons over the past century, we have Super Typhoon Haiyan in 2013, for example. We saw this public health challenge of handling thousands of bodies, and the issues of maintaining dignity, mitigating death risks, and also mitigating trauma for the communities. Then also comes the communicable diseases. Leptospirosis surges are expected, especially when we have flood waters contaminating everything. In our evacuation centers, we expect the rapid spread of flu, but also skin diseases like scabies. We see outbreaks of these diseases that we thought we'd controlled. And then, of course, the mental health tolls is also staggering. We have trauma, worsening of existing mental illness, acute stress responses, but we've also documented longer-term behavioral changes, increases in vices, negative coping mechanisms, substance abuse, as people experience, the far-reaching and protracted mental health impacts of climate disasters. And then, of course, and this does not always get reported, but climate change and climate disasters also lead to gender-based violence. In the Philippines, we've seen how gender-based violence and prostitution often spikes immediately after disasters. And it's not so hard to imagine when people lose everything, and they still need to, you know, um, uh, earn money to put food into their tables to feed their families. When they lose everything, they resort to selling whatever is left for them, which is their bodies. Malnutrition is also something that's not often talked about. It's not only malnutrition during disasters, but the malnutrition that comes after disasters. What during disasters, water systems are one of the first to break down. When we have an earthquake or a typhoon or flooding, and that often leads to waterborne diseases. And in the Philippines and many other, countries in the global south, just 3 episodes of diarrhea, for example, are enough to push a child into malnutrition. Food systems also collapse, and the quality of the food, the aid that is often distributed in these post-disaster settings, they're often substandard, sometimes expired, adding insult to injury. But in many tropical and subtropical countries, we would always say that the biggest health threat of climate change is also the smallest. Particularly, we are talking about the increasing incidence, and the geographical expansion. That means more sites being affected, sites that haven't been affected before by vector-borne diseases will now experience diseases like malaria, dengue, chikungunya. So based on, just to draw out a specific example in the Philippines, we've seen since 2010 worsening dengue outbreaks in our country. And based on our most recent study, which you can also access in this QR code here, we have estimated that as much as 70% of the increasing number of dengue cases that we have been experiencing for the past decades have been or can in fact be attributed to worsening temperatures or to increasing temperatures. That's 70%. A lot of people think that dengue is a rainy day disease, but when you look at the data, most of the dengue that we are experiencing right now is not because of the rain, but also because of our warming temperatures. And how much is that in numbers? That's roughly 26,000 additional cases every week. Again, I've mentioned this before, the health system is also a victim of climate disasters. For example, when Super Typhoon Rai hit the Philippines in 2021, it damaged 41% of village healthcare stations and 28% of our hospitals across 11 regions. And think of what that means. The moment communities need the healthcare the most is also the moment when the health system is least able to respond because of these climate disasters. You have hospitals without roofs, clinics without power, health workers who themselves may be affected, who lost their homes, who lost their livelihoods, supply chains being completely interrupted, cold chains being broken, medications being spoiled, health records being destroyed. But not often talked about is really the impact to health workers. I always carry this with me every time I give this presentation. It's a quote from one of our ongoing research on extreme weather events and HIV. And one of the village health workers, when asked to reflect how does climate change impact them, she said, when the typhoon takes everything, our homes, our livelihoods, our children's future, we are still expected to show up at the barangay health station or the village health station the next day as if we are waterproof. But our health workers are not waterproof. They're not proof from not only the health impacts, but the overall impacts of climate change. But you know what? There's also a paradox, another paradox that we must confront. Healthcare itself is responsible for as much as 4.4% of global greenhouse gas emissions. And this can even increase to up to 8.5%, especially in highly urbanized settings and cities or countries. In fact, we would always joke that if the global healthcare system was a country, it would rank fifth for emissions. 71% of the emissions in the healthcare industry come from supply chains, particularly from our surgical or operating centers and our ICUs, especially with the use of anesthetic gases that are very potent greenhouse gases, but also um, our massive and extensive use of single-use plastic products in our modern healthcare systems. So, um, what then do we now do with all of this? Um, on the one hand, there's no denying that we are not gods. We can't, there's so much that we can do when it comes to changing the course of nature. We wouldn't be able to say, for example, by our own efforts, change the course of an incoming typhoon. So these climate hazards are forthcoming and they cannot be completely eliminated. But it also goes without saying that they can and should always be managed. The question now is how, no? And in the Philippines, one of the things that we are trying to strengthen, among other things, are our systems for disaster risk reduction and management in health. This allows us to move away from events-based and reactive approaches to climate disasters to more risk-based and proactive approaches, one that ensures that, number one, we have absorptive capacity. What that means is we have enough buffer stock, buffer people, buffer capacities to ensure that services continue to be provided even before, but also during and especially after disasters, but also moving towards health systems transformation, finding ways by which we can reduce greenhouse gas emissions and the carbon footprint of our health system. A very important component of our disaster risk reduction and management and health strategy is this concept of health service continuity planning. This is something that we have initiated not only for climate disasters, but also for human disasters like the conflict that has recently plagued the southern part of the Philippines in Marawi. The whole idea of health service continuity planning is that we need to plan for ensuring that essential services are provided during and after disasters. We cannot afford to just start planning when the disaster has already commenced or started. We need to plan ahead of time. But also, most importantly, we need to plan for it in the first place. Okay, because we cannot afford to not provide health services to begin with. I'm more than happy. I think in the interest of time, I just gloss through health service continuity planning, but some normative essential elements here would be establishing your minimum initial service package. You can't provide everything, but the minimum that you can provide, it should be essential and critical to population health and should benefit the most number of people. This is an example of a service prioritization matrix that we use for different settings from the primary all the way to tertiary care level. We also talk about resource planning and adaptations. Most importantly, surge capacity planning. What triggers do we look for to activate our additional human resources, to activate our buffer stock of medications? And lastly, how do we build back better? After, the disaster has, settled down, how then do we transition back our health systems to better ways of doing things, to better ways of providing health services? And I've mentioned earlier that in terms of not just ensuring absorptive capacity, but also finding ways to transform the health system to make sure that we reduce our carbon footprint. We have in the Philippines our Philippine Roadmap on Health and Climate Change, which, among other things, tries to mainstream our standards and best practices for green and safe health facilities manuals, our green and safe health facilities. This is through the smarter approach, from strengthening our workforce to even mainstreaming green architectural and green building designs to engaging communities. Because really the thinking here is that the best way to decarbonize the health system is to not get people to be sick to begin with. If people are not sick, they won't have to use the health system. And that significantly reduces the carbon footprint of the health system. Now, what is the role of universities, academic institutions, and advocates like this forum? The Sustainable Development Network identifies four critical areas: research, education, operations and governance, and external leadership. For universities like ours, it starts with us. So it's ensuring that we have efficient and green and sustainable operational procedures when it comes to um, water management, energy use, but also transforming our curricula. A lot of people think that only environmental science courses need to learn about climate change, but now we are realizing that all courses, all programs of learning, health, law, engineering, architecture, politics, can be linked to climate science, to climate change and equity, and of course, ensuring community well-being. But more than our internal mandate, we also have an external mandate by brokering and using, academic research to influence policy, to influence national adaptation plans, and to most importantly engage communities. And I think with that, I'd like to end. Thank you very much for listening. And I'm happy to answer some questions if you have any.
Wow. Thank you so much, Dr. Jello. I think even though I'm in healthcare, I've learned so much and so much from your session today. And I have a million questions in my head, but I know if I start, my team members will send me out of here. But at the same time, thank you so much. You've been really exceptional. But before we go ahead, can we have a group session, please? A group photo session, please. Please switch on your cameras just for a minute or two. Carl, please do the honors.
All right, yeah. I just realized that everyone can't open their cameras because apparently they're in the attendance list. But yeah, I invited you guys temporarily as panelists, but feel free to join if you want to. If you can't open your cameras, that's totally fine as well. Okay, just a second. Okay, some people are still coming in. Yeah, it was a very, very interesting take with the nexus regarding climate change and health, and also I never thought about like decarbonizing the health sector. I didn't realize that the health sector itself is also a contributor when it comes to emissions. That was very interesting. But I'll reserve my questions later. Yeah. All right. We're still joining. We're still waiting for the others. All right. Okay. All right. Counting. Okay. So if everyone is ready, counting to 3, 2, 1. All right. Doing another one. Okay. Just a second. Okay. Just still loading. All right. Counting to 5, 4, 3, 2, 1. All right. Thank you so much.
Okay, thank you so much. So I think we can briefly take one or two questions before we bring on our Deputy Director to give us a short message. Do we have any question? Okay, I think I will start. Dr. J-Lo, thank you so much for that exceptional session. I learned so much. My question is, looking at the outcome of the COP30 in Belém, and also looking at the equity in climate change and health, do you think there has been any positive outcome? Because from your session, I'm looking at it, I'm in between hope and despair with everything that I've seen and everything going on. Do you think the outcome kind of like gives us any hope in that regard? Do you think looking at the global south, is there anything to be hopeful about from the outcome of the COP30?
That feels like a Miss Universe question, by the way. But um, I think hope is a strategy. Hope is not just, it's not just something that we dream about or we pray for. It's something that we strategize about. I think in terms of the outcomes of COP 30, um, there have been some, breakthroughs as compared to COP29, but there are still, we've mentioned about massive influence from fossil fuel lobbyists in the COP30, not enough having indigenous people's voices in COP30. We talk about climate action still not being localized enough and not being place-based because, climate, most of the climate action is happening at the national level, but climate change or climate impacts are experienced most acutely and immediately at the local level. And many of our local governments, our local communities are not as engaged or galvanized to address the impacts of climate change. Um, I also think that uh, transformative climate action also happens outside COP30. I think we do whatever we can when it comes to the negotiations during COP, but where the rubber hits the road is when we go back to our home countries and do the real work.
Thank you so much. Do we have other questions? Carl, do you have a question?
Yeah, but maybe we can go first with like we have a question in the chat box
Okay.
actually.
Okay, I think we have a question. Question is, what should be done to limit the influence of fossil fuel cartel in shaping the future climate action policies? Dr. Jalo?
Oh, I think the organizers of COP should really be particular about representation. They're the ones who they're the ones who send the invitation. So so really, I mean, uh, the burden falls on them to change the dynamics of who gets to sit in the table. And that's uh but also I think another very important aspect is for countries, for example, and other sectors to also make sure that their delegation are representative, especially of the people who are affected by the impacts of climate change. So we talk about indigenous people being formally given a space to share their lived experiences, but also to share solutions that many of our indigenous people have been doing and have been proven effective when it comes to mitigating or adapting to the negative impacts of climate change.
Thank you so much. I think we have another question from Ruby. How can we promote health outcomes, improving the lives for persons with disabilities as they are most vulnerable to climate change?
Oh, this is very important. I can go on and on about this. So right now, when we look at, in terms of research, for example, the most that research does is to establish the impact of climate change on, populations as a whole, male versus female, and by age. But I think other vulnerable sectors like persons with disabilities, persons with lived experience, those with mental health issues, LGBTQIA communities. These communities, we don't know if they are really impacted by climate change because we're simply not just producing evidence. So I think number one, we need to produce evidence to further substantiate the impacts of climate change to these specific populations. Number two is we need to make sure that our national and local climate action plans take a particular and preferential option for vulnerable populations. The tendency for many national adaptation plans, climate change adaptation plans, is to implement templated for all interventions. But we now know that even if everyone experiences the impacts of climate change, different populations with different vulnerabilities will experience the impacts differently. So we just can't be inserting templated for all interventions, and we need to insert some targeted interventions for adaptation and especially for these vulnerable populations. When we talk about health service continuity planning, we need to provide certain, a very clear example would be when we design health services, makeshift hospitals. How do we ensure that makeshift hospitals in a post-disaster setting will also be accessible for PWDs? Will also be inclusive for LGBTQIA and indigenous populations. So, yeah, it's really just about having preferential option and attention to vulnerable sectors and not relying on cookie cutter templated solutions.
Thank you so much. Okay, I think these are inputs from, okay. Before I go to that, I think there's another question from Irene. Do you think there is enough community awareness and sensitization on climate change causes and its impact? Because I feel that people only see the impact, but do not necessarily know the root causes and how they can come in managing or even mitigating them. What do you think is the way forward for real action?
So there are various forces at play here. We have number one, misinformation. Even to this day, we still have a lot of people and very important, powerful forces maintaining and spreading the lie that climate change is not real, when in fact it is very much real and experienced by many different at-risk countries around the world. And then I guess another important setback is this false dichotomy or competition between climate resilience, climate change, and development. You have certain powerful people saying that, we shouldn't focus on climate change when people are dying because of poverty and disease. But I think that's a false dichotomy because, these crises, these problems, they occur together and they're very much linked with each other. And we cannot just be addressing one over the other. So they have to be addressed alongside with each other, protecting both our current socioeconomic reality and protecting our future climate reality as well. But I also think another area is that it's not lack of awareness, but a sense of either apathy or helplessness. And I think this is really where we would like to mainstream spaces where people can be galvanized to think of disruptive, innovative, transformative solutions that can be implemented now, because we cannot afford to wait. So when you have presentations like this, it's very much easy to be depressed and to come out of a lecture and say I can't really do anything. But we also need to create spaces wherein we can inspire and galvanize people, because you can and should always choose to do something. Yeah.
Thank you so much. I agree with that. Okay, let me take this last question, then we can come back later to questions. Okay, interested to know how people in the grassroots, especially those whom you have engaged with, react to the climate crisis. Do they immediately associate typhoons, heat stress, and health problems to the climate crisis, or is it climate change still something quite foreign to them?
Very interesting is that even before all of this climate science have been mainstream in media, many of our farmers, many of our fisher folk, many of our indigenous peoples in the Philippines have already been taking note of the signals of a changing climate. They didn't need to wait for AR6 for them to understand that our environment has significantly changed. My grandmother, who herself is a member of an indigenous population in northern Luzon, talks about, we no longer see enough fireflies. And they've known these signals for the longest time, and they're very much aware of our changing climate.
Wow. Okay, before I call in David Muya, there's something Maya dropped. She said the prayer is that people keep getting disturbed into action and not be numb because of fear and frustration. I think that's really important. So let's...
So I think it's really important that more than just climate educate, it should be climate innovate. as well. We need to provide spaces for, different groups at different levels to be able to do something.
Thank you so much. And I really like that. So I'll call in David Moya, is the ATO Climate Educate Deputy Director for Education and Advocacy, to give us a short message and probably an overview of our discussions today. David, you're welcome to the floor.
Okay, thank you, Rashida, and thank you, Dr. Gelo, for the powerful presentation that you have given to us. As you were speaking, as you were presenting, there were some questions I was asking myself. Do we truly understand climate change? If we don't understand how it affects our bodies, our mental health, and access to basic needs, then we really do have a problem as a community. And especially in the African community, I was wondering or asking myself this question. After hearing today's presentation, what inequality or health impact stood out to me the most, and why does it matter for my community? So I guess you have left me with a responsibility of going back to my community, of going back to my community members, and start this action to the grass, because it's really
I think you're breaking, David.
Of climate change and for the attention, and I hope also be the same. So back to you.
Thank you so much. I think that's really valid. Okay, Dr. Jello, would you still love to stay with us? We have another session for our three moderators. Would you still like to stay with us when we have one or two questions for you?
Yeah. Well, sure. But I'm happy to answer like one or two more questions. Thank you.
Okay, thank you so much. So I think I'll be calling Raisa.
Yes. I'm sorry, Rashida. This is still for the question and answer, right?
Okay.
Rashida?
Okay, what do you say?
This is still for the question and answer, right? Or the...
Yes. Okay, I think we just need to proceed with the, we're supposed to have a breakout session, but I think we'll be having it right here. Should we start with
I have a
David?
question.
Okay, go ahead, Carl.
Yeah, yes, I think we were turning it as a question session still. I was just wondering to ask about how do these innovative health systems would still operate despite the overarching issues with the governing systems. For example, I mean, the Philippines is one of the suitable examples of having a really good and innovative health system. I mean, somehow in paper, but like the overarching governance system is somehow suffering from corruption issues, misgovernance, poor governance. How do you think will these systems go into like the mainstream or the current health regime that the Philippines have? Like, how do they basically become mainstream? Like, I'm curious, how do health professionals in the Philippines like basically push for this? Like I'm really curious because like I worked in the academia, but more on the sustainability side. But I've never heard from anyone who's really working into like public health, for example. I'm curious from Dr. Jello's take about this.
There are actually many different fronts. First is in terms of climate education. It is quite ironic that, for a country where we see a lot of climate impacts on health, climate and environmental education in health professionals education is not mainstream. In the Philippines, less than 3 hours in the 5-year medical curriculum is spent on climate and environmental education. And when we think about what I said earlier, that almost every disease can be linked with climate change, um, that gives us an impetus to mainstream climate and environmental education, not only in the education of our doctors, but also for our nurses and our allied health professionals. One of the innovative things that we're doing at the Ateneo School of Medicine and Public Health is that we're assisting, different medical educators to try to incorporate climate and environmental education into their, lecture portfolio. We establish case studies that they can give to their students as exercises. The Ateneo School of Medicine and Public Health offers not only a Doctor of Medicine, but also a Master of Science in Environmental Education. These programs are
Okay, I'm not sure I can hear Dr. Jello again.
length of stays, increasing the efficiency of bed turnovers. These are operational efficiency improvements, but these are also improvements that can truly reduce the carbon emissions coming from our healthcare facilities. Another important area of innovation, I guess, is in terms of monitoring. A lot of his hospitals and healthcare institutions aren't able to decarbonize themselves because they don't know where they're at. They're tracking, health outcomes, they're tracking admissions, but they're not tracking energy use, water efficiency, waste reduction, or waste consumption and production. So yeah, that's one of the things that we're also doing. We're trying to help many hospitals do their own carbon emissions inventory, greenhouse gas inventory assessments. Um, oh gosh, a lot more. um, but I think what I'd also like to address, last two things, to answer or to address some of the important points that you've raised, Carl, is that number one, a lot of many people in the healthcare industry and healthcare leaders think that greening our health facilities is an expensive endeavor. It doesn't always have to be. We have what we'd call low hanging fruits, low cost solutions that have higher impacts, or significant impacts. We talk about something as simple as ensuring proper maintenance of our HVAC or air conditioning systems. We've seen in some model hospitals here in the Philippines that by simply increasing the frequency of the preventive maintenance of your HVAC, reduces significantly your energy consumption and use. Changing your um, uh, old bulbs into LED lights is also another low-hanging fruit. Installing water-efficient fixtures and faucets, also not as expensive. Motion activated lights and air conditions is also another. So for some investments, they there will really be some high upfront costs. But when you compare the long-term benefits, not just to health outcomes, but also co-benefits to the environment and the society as a whole, these would definitely be greater as compared to the upfront short-term costs. And I think lastly is, um, you've mentioned about how this climate crisis happens in conjunction with our other environmental crisis, but also political and socioeconomic crisis like protracted poverty and also corruption, which is why we have to make it a point that we don't just address climate change in silo or separate from all of these other issues. I think the reality that we're living in right now is what we call a polycrisis. Some other people may even call it a perma crisis. But all of these crises, they happen in conjunction with each other. It's one plus one is equals to three, four, and five. And we can't afford to isolate addressing the climate crisis from all of these other issues.
Thank you so much, Dr. Jalo. So for our next session, I'll be calling in 3 of our team members. They'll be giving us guiding questions, and of course, we can ask questions and respond however we want to have it. This is just going to happen for 10 minutes. So I'll be calling on David Muya. He's the ATO Climate Educate Deputy Director for Education and Advocacy. Then we have Irene Onwuji, the ATO Climate Educate Social Media Coordinator, and Ruby Criticus, ATO VP and ATO Climate Educate Director for Education and Advocacy. So you're welcome. So you have 3 minutes for each question and answer. So let me start with Ruby Criticus.
Okay, guys. So for the question,
Okay, or David.
yes, maybe.
David, can you go ahead?
Yeah, maybe. For the question, well, becomes specifically analyzed and
I think you're breaking from my end.
ways. So mainly get yeah.
Okay.
Can you hear me right?
Yeah, I can hear you now, but I think you're breaking. I might just help you with that. I think the first question is,
So how can we ensure that needs relations includes
okay.
so we can be to share their insight.
David, you're breaking. Probably I should just help with the question. I think the question is, okay, Ruby, raise the hand. Ruby, you can go ahead.
I wanted to assist David since he is having a technical issue. So I think the question that David is asking is how can we ensure that climate health programs address the specific needs for marginalized and vulnerable populations in inclusive and participatory ways. And I think the doctor did mention that it is really important for us to really ensure that we are adding marginalized groups in policy decision making, just as the ended COP did have the emphasis on individuals and also indigenous groups coming on board in order to ensure that policies are designed to ensure that health outcomes in climate education are also made priority. So I thought I add my response to that. If there's anybody with a question or query or any addition, please, you may go ahead.
Okay. I think, can I chip in something? I think it is important when decisions about marginalized and vulnerable people are to be made, you don't just make it and leave them out. They should be included. They should be at the decision-making table. You're not just making solutions for them. You have to make solutions with them. So I think it's really important to make it really inclusive. Everybody, probably you have representatives from these either the households or the society or the community that it's been probably you're making solutions for them. Let them be involved. Let them be part of it. Let them be part of the decision when you're making these decisions for them, because at the end of the day, they'll be the one making use of it, not you. So I think it's important we include them when we're making decisions about things that truly affects them. Thank you.
Okay, maybe I should go ahead with the second question. Can everyone hear me?
Yes, I can hear you. Please go ahead, Irene.
Okay. Like all of us can read, the second question asks, how can we drive climate stories to action by the communities that promote both the people's health and planetary health as well? I mean, before I give room for anyone that wants to, answer or give their suggestion. I personally believe that stories are like climate stories, particularly, are like one of our powerful tools when it comes to driving actions in this regard. And I also know, and I know that many of you will agree with me, that stories are even more powerful when they are being told by the people who these stories are like their experiences. Right. But then we have to also keep in mind that the action that we want to, you know, hear or talk about here are the actions that these people who experience these things, that's the communities, can also drive themselves. This is not a call for help for the government or NGOs. Like, how can they, with their stories, drive actions that can help them, improve both their health, which is like the resultant effect of the climate impact, and the planetary health, which is like, the causes, right, of this impact. So yeah, it's open for anyone and everyone.
Thank you, Irene. I also agree with that. And I just want to add that it's also connected to what Rashida said about having these spaces, and what also Dr. Jello highlighted a while ago about communities, indigenous groups, and all those vulnerable groups having spaces, or authorities or people who could, or policy actors that can do that, that can open these spaces for them and empower them to share their stories and build from them these policies like that. Yeah.
That's right. Thank you. Any other person wants to add
Oh,
something?
okay, I was thinking for this, I think it's important we incorporate the media into this, because even if you have the stories to tell and nobody's actually giving you the visibility, the stories are not being pushed out. There is no way this will be promoted. I think it's important we incorporate media into this, however we want to do it. Social media is an important tool for whatever stories we have when it comes to health, when it comes to climate change. If we really want to get it out there, I think it's important they are part of this as well. Thank you.
Yeah, thank you. That's valid. Any other person? Okay, just maybe just to close this question, more like a plea or a nudge to all of us, because I believe that every one of us, we are coming from one community or the other, even though we might not necessarily be living in our real communities. For some of us, we are from Philippines, we're living in Sweden. I'm from Nigeria. I'm currently in France. But I want to believe that we all have connections with our real communities, and these things that Dr. Apostol had just shown us. I mean, I was quite taken aback. Like, these things are happening. I know that it may not really be in that magnitude, but they're quite happening in our communities. And now we have the knowledge and we have the platforms belong to this community, this organization. So it will be important that we try to engage with them, be involved, and help them get the limelight and the media exposure that even Rashida talked about. This is our story, and we all have to just be involved one way or another. So yeah, thank you all.
Thank you so much. Ruby?
No, thank you so much. For me, our next question is, in what ways can we use our stories to create a global movement to act for climate change? I think Irene has highlighted why it is important for us to tell our stories. And of course, yourself, Rashida, has mentioned the importance of media, because when we do not tell our stories, then nobody will get to hear them. Because if we live through this, we're able to give advice, we're able to, through our information, communities can design programs or initiatives that can either help them. So for example, in my community, we have a lot of floods that are happening. So as a result of that, we have advocated that drainages should be dug deep enough so that water should not go into the homes. And of course, saving the children's lives at course, either from school to home, using those public stream roads to make them safe. And it has been quite effective, I must report. The rainy season has just started here in Zambia, and we have seen a significant improvement, especially where it comes to cleaning up drainages and, of course, ensuring that these drainages a channel in which this water is channeled out of the community to save lives. So I thought I can add that. Anybody with an additional answer, please, you can join me on the floor.
Okay. I think, okay. Anybody speaking? Okay, let me just go ahead. So I'm going to pick this, even though I don't think the answer was for your question from Maye. She said, writing positive news and actions or solutions can also be helpful in building resilience and driving hope. And I think this is really actually, this may answer the third question, because climate change and impact and everything like shouldn't always be gloom and doom, you know? Because by the time we always say the negative aspects every now and then, people kind of like, they are either frustrated or there's despair everywhere. And people are like, okay, since everything is always about gloom and doom, you know, this kind of like keeps people from actually taking action. I think sometimes when we talk about climate change and its impacts and everything that has to do with it, maybe, yes, I know that there's so many negative things to it. Maybe we can chip in a bit of hope, a bit of light at the end of the tunnel, so to say, so that people are kind of like encouraged to want to take action, right? And we shouldn't discourage people from taking the little action they can from the corner of their own world. You know, little action here and there can actually help create a global movement. Thank you.
No, thank you so much, Rashida, for your contribution. And I just want to add on to say, yes, there's a lot of information out there that is more gloom and doom, because it's always emphasized the dangers. Of course, in relying with the dangers, we have to emphasize mostly on the dangers, because this is what kills, this is what destroys communities. But there's also the better side of climate change and climate change movements and global movements around climate change is creating solutions. Like the story I just mentioned, we've created the solution to this water, and it is through digging of drainages. But those digging of drainages have to be maintained and cleaned. We can't be throwing trash again in those drainages. So it's about also empowering the community to be stewardships of their environment in order to make the global movement a success. We can't just have a global movement and, like you said, it's doom and gloom, but it can have a positive impact towards the community successfully, and it is possible. So thank you so much. I'll hand over to you, Rashida. Thank you.
Wow. I think I've really enjoyed this session. It's a beautiful one. Thank you so much, Irene, David, and Ruby. Thank you so much. So I'll be calling on our Chief Director, Raisa Jokle, to give us the closing message. Oh, we don't want to go? Doesn't feel like this session to end. But at the same time, Raisa, please give us the closing message.
Thank you so much, Rashida. Yeah, I've really learned a lot from today, and hope everyone also is the same. Yeah, and we could also do this takeaways as something that we can bring to our communities or to our peers, to our leaders even. Yeah, and I think I don't have anything that much to say, because everything's that is in my mind, all the ideas, they were already presented beautifully by Rashida, Ruby, Irene, David, and of course our host, our presenter, which is, I think he's not here anymore yet. He has to leave already. And I also would like to thank the participants who are here, listening to our fourth Klima class, and probably the last for this year. And thank you so much as well for the working group team at Climatocate for making this possible, all of the efforts that you've given. It was really a nice event. And hope that everyone will have something positive to take away from this.
Thank you so much, Chief. And so to everyone, please do not forget to respond to the evaluation form so that you can get your e-certificate. I think we're going to send it via emails as well. Personally, I think it's been a very beautiful session, very impactful, very insightful. And thank you so much to all the participants. You've been so wonderful. And to everyone who has given their input one way or the other. Thank you so much. Thank you. So see you another time. Thank you. Have a wonderful weekend.
You
You
too.
too.
Hi, everyone.
Bye.
Thank you, everyone. Just a note
Bye.
for the evaluation
Take
form. We will send the link to all the participants. There is a problem with the form. We'll address that after this. So don't worry. We'll send you the link. Thank you. Thank you, Rashida. Thank you, everyone.
Thank you, Irene.
Thank
Thank you,
you,
Carl.
everyone. Bye.
Darling. Thank you, Maye, David.